I'm Dr. Messina. Today we're going to be discussing Botox and Dysport injections for men. We're going to touch upon why men are suddenly interested in receiving this neuromodulator, as well as what areas of concern they have. I'm also going to discuss the benefits specific to men and some of the things that they should be concerned about should they be desiring to receive this treatment. If you do like this type of medical information, remember to click subscribe and hit the bell to be alerted to my future videos. Over the past 7 years, I'd say the male population in my practice has increased probably 60%. Men have been coming in now more often to receive Botox and Dysport. The regions they're interested in are basically the same 3 regions that women are interested in, namely the glabella complex between the eyes, which is involved in depression and inward motion of the eyebrow, the frontalis, or the forehead, involved in raising of the brows, and the crow's feet or lateral rhytids on the sides of the eye. When I discuss with the patients why they suddenly are interested in receiving the neuromodulator, you get the same answers often as you would get with a woman. They want to look younger. They want to look refreshed and vital again. And who doesn't want to lose some lines and wrinkles that are associated with aging to look better? It's a great thing with really no downtime. However, some men tell me something that I didn't think of. They might tell me they're working longer. They're working beyond what they thought would have been their retirement years. And they don't want to look tired or older amongst their peers or amongst their colleagues. Salesmen in particular come in and specifically request the glabella complex between the eyes. For one reason, it is one of those areas where it pulls the eyebrows in and down, and it gives you a scowling appearance. And a lot of salesmen say, we don't want to look like we're getting angry with the customer or we're scowling at the customer. It's a very popular area for salesmen. The forehead, again, mostly to reduce aging, and the lateral rhytids at the sides of your eyes, again, are more associated with aging. Now, when we are doing these injections, we have to be mindful of what the person's profession is. This is both for men and women, but there are some professions that Botox and Dysport just might not be a good fit for. Anything where you need full expression, such as an actor. Some attorneys as well. They want to be able to show expression in the courtroom, and therefore they don't want to be frozen. And being frozen is a common misconception. The amount of motion you lose with Botox and Dysport is basically a function of dose. So if you give a full dose, and I'm going to get into what the dosages would be in a moment, if you do a full dose, you will lose the ability to depress the brow and elevate the brow. The lateral rhytids at the sides of the eye, the crow's feet, in general, you don't notice any motion loss. You just notice that you don't have the crow's feet anymore. If we give less of a dose, you then will have more motion. So some attorneys and some actors, they might opt to get a lower dose. You don't get the optimal outcome, but you do lose some lines and wrinkles, and you still have some motion. As far as freezing of the whole face, that's more of a Hollywood thing for jokes. Botox and Dysport, when done for the most common regions, will block motion from the corner of the eye up, not around the mouth. You'll be able to speak perfectly, you'll be able to speak clearly, you'll be able to smile, and anything that the lower face wants to do. Now, dosages. Dosages in men and women are different. Men require a higher dose. With Botox, the average female takes about 50 units to do all 3 areas. The glabella complex between the eyes generally takes 20 units. The forehead takes anywhere between 10 and 20 units as well. And the crow's feet, you could figure 6 to 10 units per side. So in general, women take about 50 units of Botox and 150 units of Dysport. Men you could expect to take about 60 units of Botox, maybe even 70. And then, of course, 180 units of Dysport. Men, just due to their physical muscular anatomy, require more Botox and Dysport. How long does it take Botox and Dysport to kick in? It's a very common question. In general, if it's your first time ever receiving the neuromodulator, it's going to kick in a little sooner, and about 3 days into it, you're going to notice something is different. It might feel a little heavier to you. You might notice a little less motion. By 6 days, there's a significant loss of motion. And by 14 days, you're kind of locked in. That's what you're going to get. If you still have motion at 14 days, you're not going to get any more blockade after that. The Botox and Dysport in men and women lasts approximately the same time, usually 3.5 to 4 months before you start to see motion, and the motion progresses not immediately, but over the course of a few weeks, it progresses to the point of where you have full motion returned. And then you could opt to have another round of injections. Now let's look at some before and after pictures. Here we have injection of the glabella complex. As we notice, we see those lines above the nose, patients often call the 11 lines. And here, about a week later, we see those lines are markedly softened. Some are completely gone. You can have them gone provided that they're not static. In other words, the rhytids of the forehead and above the eyes and on the crow's feet, if they remain there, even when you're relaxed, that's called a static rhytid. And it will eventually go away, but probably not after one round of Botox or Dysport. Now let's look at the frontalis, or the forehead. As we see, approximately a week later, we have lost a lot of motion in the forehead and a lot of the wrinkles are gone. As for the crow's feet, I hope this answered a lot of your questions regarding Botox and Dysport for men. If it's something that you want to do for rejuvenation or just to look more vital on the job, then it might be a good choice for you.